Open kit and maintain sterile field. Have patient go into position to open up the lumbar intervertebral space. Palpate for the patient's iliac crest and find the midline. Find the space between the two spinous processes and note where you will administer your anesthetic. With sterile gloves on, remove the components of the kit on the sterile field and prepare the materials to clean the patient's back. Begin cleaning the patient's back with the betadine soaked sponges. Hold the sticks with the handles pointing upright to prevent contamination. Begin in the middle and move outward in a circular motion. Repeat this 3 times. Place the drape on the patient's back with the opening over the area where you will be administering the spinal. Make sure to maintain sterility. At this point, you can feel again to confirm where you want to place your needle. Also make sure the patient is in a good position.
Next, inject the local into the back, starting with a wheel at the skin and advancing your needle forward, injecting along the way. At this time, you can use this needle as a finder needle to ensure that you are midline between the processes. Now, take your TUI needle and advance into the skin, bevel up. Insert the needle directly into your previously made skin wheel. Advance the needle until you become engaged into the ligament. At this point, the TUI needle will be sturdy. Once engaged, remove the inner stylet from the TUI needle and attach your loss of resistance syringe. The syringe may be filled with saline, air, or a combination of both. Advance the TUI needle a few millimeters at a time, tapping on the plunger of the syringe each time. Continue advancing in this fashion until you feel the loss of resistance and the plunger of the syringe smoothly slides forward with minimal force applied. Next, count the marks on the TUI needle to identify at what centimeter you lost resistance. You will add between 4 to 6 centimeters to this number, and that will be the number at the skin when you secure your catheter. Begin inserting your epidural catheter through the TUI needle using the assist guide. As you thread the catheter, be sure to keep the TUI needle stabilized so it does not advance further into the patient. Once the catheter is inserted to its desired length, usually a few centimeters more than where you want it to be at the skin, slowly begin to remove the TUI needle out of the skin, making sure that the catheter does not come out with it. Once the TUI needle is removed, you can slowly pull back on the catheter to the desired marking at the skin. Never pull back on the epidural catheter while the TUI needle is still in place. This can cause shearing of the catheter. Next, you will attach the catheter connector clamp to the end of the catheter. Attach a syringe to the connector and aspirate to ensure there is no CSF. You can then attach the filter where you can inject medications into. Now you are ready to give the test dose. After administering the test dose and ensuring the epidural catheter is in the correct location, secure the catheter to the patient. Ensure that the catheter is not kinked prior to securing it. Oftentimes, the catheters are draped up the back and over the shoulder of the patient, taped to the skin along the way.